Hi everybody, Dr. Paula Sauer here. Today we're going to go over a beginner lunge sequence. A lunge normally looks like this, come down all the way, and back up. But for some of us watching this, that looks painful and undesirable. So I'm going to break down a simplified, modified version of a lunge for you to do at home. This would be your post-op, you have arthritis, not moving well, but a double leg squat isn't hard enough for you anymore. So you're kind of in this in-between stage. So we're gonna progress, and the progression becomes the lunge. So let's get started. Okay, so you can see I have a chair here. I have a chair and I have a wall. So you have options here. I'm gonna show you both. If you don't have a chair you can move and have at hand, and you've got some wall space, all you need to do is take a long step. So your front leg is forward, your back leg is back, and it's a very long stride. My back heel is gonna come up, right? So I'm not gonna have your foot all the way down. That would give you a calf stretch in the back. Instead, the heel comes up, you'll be on the ball of your back foot. Right now, my right leg is forward, my left leg is back, my right hand is against the wall. And then I'm just going to bend my front knee a little bit and my back knee just a little bit. Okay, so when you're first starting to do this, maybe you're only going an inch or two. And when you are doing this, you can keep your hand on the wall, but you're not to lean against the wall, okay? You want to be upright, you want to stand upright. And where you're going to feel this is in both legs. Oh, if you don't have wall space, the other option is to use a chair. You'll step your left leg back, keep your right leg forward, and then we're just bending both knees just a little bit. Why are we bending both knees? Well, our goal is to eventually get down to here. For some of you, maybe you never get there, and that's okay, don't worry about that. It's about exploring space, exploring movement in a way that doesn't hurt, and that keeps you strong, and then keeps you healthier, keeps you more mobile. So we're gonna move a little bit down, come back up. So whether you're at the wall or at the chair, let's go. 2, 3, 4, 5, 6, 7, 8, 9, and one more, 10. Great job. Use the chair or use the wall, and you're going to change your stance. Now the left leg comes forward, the right leg goes back, your right heel is up in the air. Stand up tall. If you can keep your belly a little tight, great. Bend both knees. Come back up. 2, 3, 4, 5, 6, 7, 8, 9, and 10. Great job. So for some of you, maybe one knee forward hurt more than the other. We want to stay out of the pain in general. If you're getting like a 1 or 2 out of 10 pain, see with the movement if that gets a little bit better. If it doesn't and starts getting worse, you're gonna not do this activity, go back to the double leg squat or go back to something you were doing earlier. You're not ready for this, that's what that means, okay? For those of you where it wasn't painful and you feel like you can do more, great, I'm gonna show you the progression right now. This one I'm gonna use the wall, but you can certainly use the chair as well. So, you take a long stance, right leg forward, left leg back, left heel is up. Belly nice and tight, and we're gonna try to drop further down and then come back up. If you have knee pain and it hurts to weight bear through your knee, you'll take a pillow. That's gonna be the target for your knee when you hit down. Boom, right there, okay? So that when you touch down, you have a soft landing versus hitting something like a wood floor, which I have here, or carpet, which still has hard flooring underneath, okay? So bend both knees, touch down, come back up. Let's keep going. Good, and 5, 6, 7, 8. We're tightening the thighs as we stand up on both legs. And one more. And great, now we switch. Left leg forward, right leg back. You want to see the chair variation here? I can do that for you. Just need to make sure you've got that target. There's where I'm going to land, okay? Ready? And bend both knees. Find that landing point, come back up. 1, 2, 3, 4, 5, 6, 7, 8, 9, last one, 10. If you can't touch the ground, bring the ground to you. So if this is too low still, put another pillow on top of it. Layer your pillows up so that maybe you're going and you're coming down a little bit further from the first squat, the first lunge, I should say, to the second one there. Eventually, you want to try to go all the way down to the ground, but again, if we don't get there, that's okay, don't worry about it. All right, thank you so much for doing this tutorial on beginner level lunges. Again, this is for somebody with arthritis, knee pain, post-surgical, they're just getting their strength back. A squat is too easy. Now what? Do these lunges, okay? If you have any questions, post it down in the comment section. I'm happy to oblige all those requests. Thank you so much for participating, and I look forward to seeing you all online soon. I'm Dr. Paula Sauer. You can email me at paula@alignptla.com. You can even do a virtual visit with me if you go to my website, alignptla.com, and click and request an appointment, okay? Or send me an email. All right, everybody, see you all soon. Be well.